attention to the ways in which we language that are symbolic or that are not verbal, like me doing this, and paying attention to all the signals that a client can give us that might indicate a function, right? Like a shoulder shrug could be, I don't know, but a shoulder shrug could also be, don't ask me that. Right? And so like knowing those kinds
ask me again, ask me more, don't let this go, but I don't know what to say. Yeah.
Precisely. And as a therapist, I think what you have to do is experiment a little bit, try one avenue and try another, and see what opens and see what closes.
Mm-hmm. One of the things that I'll tell trainees sometimes is, okay, before I even go into processes, it's like flexibility, inflexibility. Can you just make that kind of discrimination? Oh, it looks like it's getting more flexible. Or it looks like it's getting more inflexible here. And that as just a very basic, differentiation, in context, in this moment, can you recognize that? And one of the things that I'll tell them is, and then do something. And if it moves them towards flexibility, then that's something that you can use again, something functionally the same as what you just did, that you can kind of move them in that direction. And if it moves them towards inflexibility, it's not a waste. It's not a rupture of the relationship. You now know that that's more rigid than you thought. You now know that kind of intervention, that kind of shift in the relationship is going to go that way. And you can always stop and notice that, with the client. That can be part of it. I think the other thing that we underestimate is our nonverbals and how much that influences our clients. Sometimes we're so busy looking for the thing to say, and I say we because I like to talk. We're so busy looking for the thing to say that we miss that the words are not the thing that's most important. Sometimes with trainees, especially here at the university, where I have lots and lots of hours with them and they're kind of captive. I'll pause them like as if I have a remote, but I'll pause them in real time in role plays in front of the room and say functionally the same, fewer words. Okay, functionally the same, fewer words. Functionally the same, fewer words. Okay, no words, same function as what you just did. Whether it worked or didn't work, she didn't even get a chance to respond yet. And just have them play with how powerful just being with someone else is. It's not mind to mind.
Right. I think that when I think about body language and use of silence, sitting with somebody waiting is also part of learning how to master, I think, in this area. It's like there's a patience and a quality of not leaping in too quickly that our mindy sort of technique-y part tells us to do. And I think sometimes what happens is the clinician will see the client tearing up and think that, okay, that's the time to say something. Right. But they might be like, now sit with that.
Yeah.
But actually saying anything might bring the person out of it. I mean, of course it depends. You were right when you said it all depends. People don't like that answer very much. It does. It depends. And just waiting a little bit longer might actually invite more of the emotion than telling somebody to sit with it. There's a really subtle distinction right there. People get really surprised when I tell them things like, I once sat in silence with a client for 40 minutes. Like, they can't imagine it like it. But there are times, I'm not recommending that, by the way. It was functionally appropriate for that particular client. Here's what I think is that we get sort of focused on the techniques and we lose that interpersonal process, the patience, the observing of patterns, the larger things that are going on, and there's sort of the tools. And what I guess I would want anybody watching to be aware of is that the tools are inside the therapy, they're not the therapy.
Mm-hmm, mm-hmm, mm-hmm.
Yeah.
People could use tools that are highly associated with ACT that people would recognize and think of as ACT moves and be not doing ACT. And what I mean by not doing ACT is not fostering psychological flexibility or building, psychological flexibility in service of valued living. And I think that's absolutely the case.
Yeah.
And, let me ask you this, because the more consultation that I do where I'm watching tape with clinicians and we're reflecting, the more important I think, and maybe this goes without saying, but for me, the more important I think it is to train people explicitly in their awareness of their process, of their own process in the room, of their own thoughts and feelings as they're sitting with clients, of their own reactions, not as distractions that they need to set aside so that they can zone in, but as part of the whole experience, in the same way that we wouldn't say, don't look at their feet are not important, or don't look at, any part, or ignore what's happening outside, just act like it's not happening. If something was happening outside and you were trying to ignore it, it would make the interaction crazy, because you both know it's there. You would both turn and go, wow, sorry, I don't know what's going on, or oh, that's frightening, or whatever, because it's part of the shared experience. And while our clients aren't reading our minds, fortunately, I don't think that we can assume that our process, our own private thoughts and feelings are totally private. I mean, they are impacting our interactions with our clients. And so if we are trying hard to, suppress them or not pay attention to them, they're still impacting the interaction. And I think it's as bizarre as ignoring that the window is rattling or that the electricity went out, because that's not the therapy, So an example, I was watching with a consultee, kind of frozen and just really kind of disappointed with the way that that he responded to the client. And he said, and then I said something stupid, and oh, stop it. And he was kind of upset. And I said, well, let's go back, and I just want you to tell me what shows up as you're watching the client. And so we go back, and he's watching him, and he pauses, and I just said, what's showing up? And he said he just seems so sad, and like what he's describing just feels so sad. And it's like, where's that?
Yeah.
Where's that in, well, I mean, what would I say? This feels really sad. That seems good. If it's obvious to both of you that what is showing up in the room is a large amount of sadness, rather than like a useful tip to handle sadness, which is where he ended up going, just saying, this feels really sad. Is this sad? I'm noticing I feel really sad right now. I mean, anything that sort of acknowledges that thing feels not just it could be okay, but feels important even.